Okay. Hi, I'm Katie Hiller. I am the program coordinator at the Bariatric Center of Kansas City. And we tried to do this topic last week, and we're having some technical difficulties. So as requested, we are going to re-record it. Some people wanted this information. We are going to talk about hair loss after bariatric surgery. We also will talk a little bit about excess skin and what you can do about that after bariatric surgery as well. So please chime in. Hopefully you can hear us this time and ask your questions. We do go back and always look at these Facebook Lives and try to answer questions even after the fact. So please ask away. So a little bit about hair. For most of your life, you're always in the process of both growing and losing hair. So the medical terms of the two states your hair follicles go through is the anagen phase, which is a growth phase, and then a telogen phase, which is a dormant or resting phase. And your hair takes about half an inch a month to grow, or grows about half an inch every month, so about 6 inches in a year. So if you think about that, when you lose hair, it takes a long time to finally see some of that growth because it's really growing, not very quickly and not very much. So you have to be patient. But we're going to talk a little bit about what is called telogen effluvium, which is a form of temporary hair loss that usually happens after a stress, a shock, or a traumatic event. So not just bariatric surgery, lots of different things can cause this phase for your hair to go into where it's not growing. You can see there's lots of different things, but there's a couple on there that just because you have bariatric surgery, you now have those risk factors for possibly having this happen. So bariatric surgery is a major surgery. You also have acute or rapid or early weight loss, which can cause that. Now, a couple other things having to do with bariatric surgery that might play a factor into this is your protein intake and iron or zinc deficiency. So we're going to talk a little bit about that as well. So what is this telogen effluvium? But it's, really where your body is made to survive, and we don't need hair to survive. So your body's resources go to other things going on within your body, not going to your hair. Usually happens about 3 months after surgery, and it usually rarely lasts more than 6 months. If it lasts more than 6 months after surgery, you'd want to look at some other causes or factors that are playing into this, specifically a dietary or nutritional deficiency or cause that might be causing this. So nutrition, things that you can do, as your hair is falling out or as it's regrowing, what you can do to make sure that you don't have any nutritional deficiencies and you're really having good hair health, we'll say, is making sure that you're getting all your protein in, because low protein is associated with hair loss. Iron is associated as well. Iron is, has hemoglobin, which carries your oxygen for growth and repair of the cells in your body, which includes your hair. So you want to make sure you're having your iron checked, making sure you're taking your iron, which is in your bariatric vitamins. Your bariatric vitamins have a lot of iron in them, and this would really help. Zinc as well. It plays an important role in hair tissue growth and repair. Also helps keep the oil glands around the follicles working properly. So it's another really important mineral, and that is included in your bariatric vitamins as well. So obviously taking your vitamins daily, including your calcium, is really going to help make sure that you have that good nutritional health. Having your blood work checked to make sure that those levels are really at a safe and good functioning level is really important as well. But when will my hair grow back if it has fallen out? Well, because the hair follicles aren't actually damaged, hair should regrow. And it should start to grow back about 3 to 6 months after that thinning occurs. But you have to be patient because it's going to take time. Remember, we said it only grows about half an inch every month. So as it's growing back, you're going to have tiny little, peach fuzz as it grows. You just have to be really patient. Make sure that you have good nutritional intake, and we just went over what that's going to look like. But if your hair loss is lasting longer, it could be a result of that vitamin or mineral deficiency. And that's why it's really important to come in if you're seeing that the hair loss is lasting longer, or you really don't feel like it's growing back as quickly or normal time that it should. You need to come in and get checked out, and we need to do a nutritional evaluation on you. Because there's other causes that would look like this as well. Some thyroid diseases, polycystic ovarian syndrome, and genetics obviously play a part into what your hair looks like, what it does when it falls out after bariatric surgery, if it falls out, because this does not happen for everybody. But if it does, it doesn't mean it's going to grow back really a lot differently than it was before surgery. So genetics plays a part in that. Now we're going to talk a little bit about skin and why you have excess skin sometimes after bariatric surgery. Well, skin's the largest organ in the body. It is made up of proteins, including collagen and elastin. Your collagen in the skin provides firmness and strength, and then the elastin provides elasticity and helps your skin stay tight. Now, when skin has been significantly stretched, when you're obese or overweight, that skin is stretched, and it remains that way for a longer period of time, that collagen and elastin can become damaged. When it becomes damaged, that's when we can have some issues with some loose skin. Some other factors that can affect that skin elasticity are age. As we age, we have less collagen, just in general. It's part of the aging process. Genetics plays a factor. If you are a smoker or you're around people that smoke, it can lead to the reduction in collagen production and damage to existing collagen. So if you smoke, please quit smoking and try to not hang around people that smoke. Sun exposure can play a factor as well. Chronic sun exposure can reduce collagen and elastin production. And then the length of time that you would be overweight obviously plays a factor. The longer skin is stretched, the more elastin and collagen is lost. But what can I do? So resistance training can help. It obviously helps you burn more calories the more muscle mass you have. Muscle, really feeds into your metabolism, so it helps you burn calories. But increasing that muscle mass can also help improve the appearance of loose skin. You're filling that loose skin with nice, healthy muscles. It can help with that appearance, make you look better. You can take collagen. You have to ingest collagen for it actually to work and produce any effect. If you just put collagen on the outside of your skin, you're not going to get the full effect of that. You have to ingest it. And collagen is found in meat, fish, dairy, bone broth, but you can also do supplements of collagen protein. So our protein that we sell here is made up of collagen protein. So you can do that. You can do any kind of collagen supplements, but you have to ingest that for that to provide you with that effect. Other nutrients that are important to the production of collagen and healthy skin, once again, protein. We preach protein, 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 protein. This is obviously beneficial for many, many reasons. Vitamin C can help with your skin, and omega-3 fatty acids. Also, making sure you stay hydrated. Skin loves water, so make sure you're getting in all of your fluids that you need to. So there's a couple of resources. As you are going through, if you are going through any phases of hair thinning, hair loss, over at Shawnee Mission Medical Center, there's a Santé boutique, and she's got some really nice hair toppers, hair pieces, wigs. I've got her phone number on here. If you want to call her, go in and see her. That's always an option until your hair really grows back and you're feeling more confident and comfortable. And then obviously if you have excess skin that you'd like to have removed around your abdomen, that's called a paniculectomy, and our surgeons do that here at the Bariatric Center of Kansas City. So please call the office if you are interested in that. Also, just please let us know if you have any questions, and thanks for tuning in, and hopefully the sound worked.